I think the number one thing we do is listen to our community. Like, what is it that they want? If they're asking for something, learn about that and build resources and tools and products. And I'd get emails from people in the middle of the night saying, like, I was up studying and I read a story of like LaShawn and Gordon, and it really inspired me to keep going, right? Because you see the art of the possible. And especially for people who are earlier on in their career, just to see individuals a couple steps ahead of them gave them a lot of like inspiration and hope. And that was the other thing. I didn't want to feature like the president of some huge public health organization. It was really like our peers, people that are a couple steps ahead of us, so that we could learn exactly what they could do.
This is the Public Health Insight Podcast.
Before we move on, it is important to note that the views expressed in this podcast are our own and do not represent any of the organizations we work for or are affiliated with.
You're listening to the Public Health Insight Podcast, your go-to space for all things public health and global health, from the Sustainable Development Goals to the social determinants of health, as well as interesting dialogues about the diverse career opportunities that exist in these fields. Remember to subscribe to the podcast and leave us a rating on Apple Podcasts and Spotify so other people like you can benefit from our content.
My name is LaShawn, your host for this episode, along with my co-host, Gordon, and a special guest.
Wait. Let's not reveal that just yet. You want to know why?
What's up?
Because we're doing things a bit differently. The guest that we're about to speak to is someone LaShawn is very familiar with being interviewed on their podcast. What was that experience like, LaShawn? What did you talk about?
I mean, this person is such a great interviewer, and this person has a great podcast that everyone should listen to, and we'll get into more detail about that. When I went on to their podcast, we talked about the Public Health Insight, a bunch of different initiatives that we've been doing, and as well as a bit of my professional journey into public health. So we're going to put this person on the hot seat this time and ask them the hard questions.
That's right. And I think we're particularly interested in learning about entrepreneurship in public health and innovation in public health, what that looks like for public health professionals, and maybe more importantly, how to build a dream public health career. A lot of people are on that journey, and we're hoping to get some insights on how we can go about doing that.
Absolutely, and I'm super excited to learn more about how I can advance my career in public health.
You need to learn more? Don't you know enough already?
We can always learn more, Mr. Thane.
Okay. I thought you had certifications in this and that. You seem like you're doing good for yourself.
The journey never stops, fam.
Okay.
All right.
And it's always good to get different perspectives.
There it is. All right.
Shall we introduce our guest?
Let's do it. Alrighty. So, Sujani is a public health professional trained in epidemiology, and she holds a master's of... Let me redo that.
That epidemiology was hectic.
I know.
Epidemiology.
It's a short sentence there. No, that was hectic. Sujani is a public health professional trained in epidemiology. She holds a Master's of Public Health degree from the University of Saskatchewan and an Honours Bachelor's of Science degree from the University of Toronto, double majoring in integrative biology and health studies. She is also the founder of phspot.org, where she helps build dream public health careers for people all around the world. Alrighty, so Sujani, welcome to the Public Health Insight Podcast.
I know, this is exciting. The tables have turned, and I think this might be the first time I'm sitting on this side. Although I've been interviewed on my own podcast by a friend, I've never been on anybody else's podcast. So thank you both.
Exciting.
Shall we start with our Google Maps, LaShawn?
Let's go for the Google Maps. Let's go. I'm pulling it out right now.
Oh, no.
You pull it out?
Yep.
So, Johnny, you got your Google Maps?
Is this...
Not actually Google Maps. Not actually Google Maps. We just thought of a fun little way to start the conversation around career journey.
Yes.
So when we conceptualize it as a Google Maps, okay, I'm going to start from what you describe in one of your pieces as a logical first step, as wanting to pursue dentistry.
Yes.
Okay, so let's start there. Plug it in, point A. Okay. But then we ended up in public health at point
Yeah.
B. So can you tell us about what that Google Maps looked like? Was it left turn, right turn, zigzag?
Was the traffic?
U-turns,
Yeah.
traffic? Like how was that map look like for you?
Yeah, so I think even before that point A, there's another, I guess, point
There's
A.
another.
Predestination. It's where you go
Yeah,
get a snack first
exactly.
before you start fuel up.
Yeah.
Mm.
So I think ever since I could remember, I wanted to be a teacher. I loved teaching. For whatever reason, and whoever brainwashed me as I was younger, I ended up going towards the sciences. And then, I just loved working with tools. And I thought, science, tools, dentistry kind of seems cool. Let me try that out. I'll go to UFT for a life science degree. Let's see how that goes. I start taking my courses there. And number one, I'm not like too enthusiastic about them. I'm doing them for the sake of having to check off some boxes. Not enjoying my first year experience, not doing well in my courses. Also ended up like volunteering at a dental office, not really enjoying that experience either. And then, you get some elective courses. So I ended up taking a course called Plagues and People with Kirsty Duncan. And she's, I believe she's still currently our Minister of Science right now. So she went from a professor into politics. So that course talked about the 1918 Spanish flu. Actually, yeah, because she had written a book about it. And so just that exposure to public health, population level kind of health and epidemiology, it was the first time I was introduced to it kind of through this elective course, and talking to a few friends, they introduced me to this like career in epidemiology. I was like, okay, what is that? Started looking for more courses. And at the time I was at the Scarborough campus, they didn't really have many courses in public health. There was a health studies kind of major I could do, but a lot of the courses were borrowed from other kind of, specialization. So a little bit of microbiology, a little bit of research methods, there were a few courses in epidemiology. So just based on the bit of exposure I kind of was able to gather there, I was fascinated by the field and decided I would let go of my dentistry dreams, although it wasn't. I felt like it took me a number of years, even after I started kind of working in public health, to really let go of that dream. And I can say maybe, 2 years into working in public health is when I was really happy with the path I was on and could finally put dentistry to rest. So it was really the first couple years of undergrad that I discovered public health and realized I was having a lot more fun with those courses. I was really kind of understanding the concepts. And as a result, I was doing much better in my courses as well. And so I ended up applying to a master's. And I've written about this where, at times I wish I had worked for a couple of years before going into my master's. And I think my experience would have been different. I don't know how, but I just have this feeling all the time that had I had a bit of, just real world experience, I could have gained a bit more in my master's. But having said that, I went into my master's. I went to the University of Saskatchewan, did a 2-year master's of public health program there, specialized in epidemiology, took some fascinating courses there. And there was a course, field epidemiology, that really, spoke to me, and I really had fun with that. We had a guest speaker that came. She was from the Public Health Agency of Canada. She was working as an outbreak epidemiologist, and in my head, I was like, oh yeah, this is kind of the dream job that I am going to go do my master's for. And this was in 2012. At the time, they weren't really hiring at FAC for outbreak epidemiologists, but there must have been this like huge listeria outbreak a few years ago, and that department got a lot of funding. And so the timing was just so perfect that when I graduated, that funding kicked in, that they did this huge hiring of like 10 people into that department. And I think I was graduating in like April. The application for that came around. I applied and started at the Outbreak Management Division in September of the year I had graduated. So it was kind of, on paper, looked so perfect. When I did my undergrad, went to my master's, and like landed this dream job. And so, with that role, I have been moving around here and there, exploring different opportunities in public health, and really figuring out what it is that I like. And maybe we can get into that a little bit later, but that's kind of how I landed in public health.
No, that's so wonderful. Thank you for sharing that. And I want to dig a little bit deeper in terms of your interest for epidemiology. So you did some of these courses in undergrad. You ended up doing your MPH with a specialization in epidemiology. You took this field epidemiology course. You had guest speakers come in from FAC. And, it seems like you consider that your dream job at the time. Why specifically epidemiology? How did you come to that conclusion that that was your dream job?
Yeah, I think, I like this idea of health and population level health. And I remember there was an elective course in undergrad, and there was a quote at the top of our reading. And it's a quote that I share when people sign up to our newsletter as well. And it's about you not being an island of yourself and you being part of the whole, and kind of everyone has to contribute to society and everyone has to play a role in it. And I think that really spoke to me in terms of like my philosophy in life. I really feel that everyone has a part to play in society. Like we can't act as an independent individual and not care for each other. And I think just hearing about different individuals like the late Paul Farmer and some of like the pioneers of public health and the work that they had done and kind of the impact that it had, the ripple effect on like society and the population. It was something that I could really connect with. I don't know if at the time I could really like say, yeah, this was like my calling or this is what I really believe in, but there was just some sort of connection there that now reflecting back at kind of the things that I enjoy doing, the things that bring me joy, I'd say, yeah, it's a lot of the pieces that public health kind of allows us to do.
Awesome. And for my own personal interest, you started in outbreak epidemiology, and I believe in doing my investigative journalism into your background, I saw something about opioids overdose surveillance as well. What was that like? Selfishly, I'm interested because I'm in that substance use space in public health. So I just want to hear from you. What was that like? What did you find? What was interesting?
Yeah, so I was doing outbreak epidemiology, so infectious diseases, E. coli, salmonella, kind of things that make you sick when you like consume some sort of food that's contaminated for about 5 years. And I came to a point where I felt like maybe I just needed a little bit of a change. And around the same time, the unfortunate opioid crisis kind of picked up steam in terms of just political intervention, funding. I mean, like the opioid overdose crisis had been happening for a number of years. The Public Health Agency of Canada was placing public health officers across the country in different provinces. And so that was a program I kind of got myself into, and I was fortunate to be placed in Manitoba, so with the government of Manitoba. So I was working there. So we're kind of like the representative that's embedded right into the province. So we are the provincial resource, even though we're funded federally. And then we also kind of ensure that any sort of national surveillance could also take place. Each province does, I guess, opioid overdose surveillance differently, just depending on how they collect death data. And that's what we were using at the time. So at the time, there was no understanding of how many deaths were taking place as a result of opioid overdose in Canada. So I was placed in Manitoba. Several other of my colleagues were placed in different parts of the country, and we were essentially counting the number of people that died as a result of opioid overdose, which was very, very emotional, I'd say, because you were reading the death records of individuals who had passed away. So I think it's important at this point to kind of mention that it was my first exposure to like burnout and just like emotional weight on myself. And I think up until that point, I didn't think public health professionals could experience burnout because it was kind of a terminology that was associated to nurses and doctors, right? People on the front line who were seeing patients, who were working with individuals in the community. So for many of us, that role was quite emotional because we were reading people's journeys of like what had led them to the decision that they made, whether it was intentional or unintentional overdose. Professionally, it was an amazing experience. My manager used to tell me, you will think back to this experience for the rest of your career. It's going to be one of those experiences that you've had that's really made a mark in your public health career. And I think, to date, she is right. I don't know what the rest of my career is going to look like, but it always comes up as something that I'm super proud of for having done. It's really opened my eyes in terms of like the population of individuals who do use drugs and the challenges that they go through. And certainly, like, I think I grew as an individual just experiencing kind of the stories that we did. And in terms of like the actual public health work, we were looking at death data, we were looking at EMS data, hospitalization, kind of other ways that we could tell the full story of what the impact of opioid overdose. And then after that, we were looking at crystal meth, other drugs that were kind of coming up. And, just to kind of understand the scene in Canada, each province was different. Each province was seeing a different drug come in. So just very interesting work. I did that for about a year and a half and kind of told myself, I think I've done everything I can and it's time for this file to be handed over to somebody else. So, so that was my year and a half journey in Winnipeg.
Shout out to Winnipeg. Yeah. I did my practicum there.
Oh, yeah. It's a beautiful city.
The Collaborating Center for Infectious Diseases. So, no, thanks for sharing that. And I think it's a very salient point about burnout. And I admire the fact that you recognize where your thresholds are and you make decisions to, look for different opportunities and to refresh your energy and your interests. And that's something that we can all take a lesson from. However, you could have stopped there, but you decided to go about and launch PH Spot. And that's something you do outside of your formal employment. So this brings me to the question, and LaShawn and I talk about this all the time, and you've sort of alluded to this as well. Is there a space in public health for entrepreneurship? This is sort of a taboo topic sometimes. People aren't allowed to think about ways to bring value to public health and to global health, to their communities, without receiving compensation that they can live on. So what are your thoughts on this, and how did you navigate all this when you went to start PH Spot?
Yeah, that's a really good point of discussion, and I'm glad we're covering it here today. But before that, I wanted to mention, you give me too much credit for this, like being able to reflect and assess where I am with things and burnout, and I was not great at it. It took me a trip to the ER to realize that I was burnt out. So I do want to encourage, anyone who is feeling like they're not able to take rest or that they need to like push through and finish projects. It's hard to identify that you've been burnt out or that you are kind of in that moment. So whatever you can do to get the help you need, whether it's talking to friends, and it took me a really long time to shift that mindset. Like I didn't think that sleep was important. So there's like a lot of changes I needed to make. So I just wanted to mention that you gave me a bit too much credit there.
Point taken. We will be sure. We have a burnout blog that we released a couple weeks ago. We'll link that in the description for people to take a look at.
Yes.
Yeah. And I do think though, Sujani, that what you're saying is just very candid and powerful, because this is often not talked about at all, especially during this pandemic period. A lot of public health professionals are out there and seeking help in different ways, but for people to share their stories and provide different resources, I think it can only help contribute to the field in terms of building resiliency and knowing your different thresholds, as Gordon mentions, and finding that support and help that you need. So I very much appreciate that point and you bringing it up so candidly.
Thank you.
Yeah, we might have to do a whole podcast on that one too, because I'm starting to think as well, if doctors and nurses and other healthcare professionals who are frontline are out there directly impacting the lives of people. They are allowed to feel burnout. But all I do is sit at my computer and research stuff, and I shouldn't feel the same level of burnout as they are. I shouldn't complain to the certain extent, but it's very taxing work emotionally, and it's something that's stigmatized, but it really shouldn't be.
And everyone feels it differently, right? So when you're looking at these patient records and you're learning about your histories and stuff like that you could form like really personal attachment just by reading that, and people perceive that information differently no matter what you're doing in public health. So definitely something to talk more about.
Yeah, and even, just within like COVID, if you were working on COVID in your organization, I think we're in public health because we are so passionate about the field, passionate about people, helping people. And so just that conversation about COVID, the way the mandates are rolling out, it doesn't stop at work. Like it kind of goes into the rest of your day. You see it in the grocery store, you see it at family gatherings, and you're like on all the time. And I think that takes quite a bit of a toll on you. And so sometimes I don't know if you both know Marissa McCool. She has a podcast called Redefining Rest for Public Health Professionals. I think she was talking about kind of like it's okay sometimes to just shut that off for a little bit and take some time to rest for yourself, whether that's like mentally or physically, or maybe it's running for you or going for a bike ride and just choosing rest for yourself and taking care of yourself. So I'd highly recommend her podcast for that. I know I'm going to be binge listening to that because I've struggled with that quite a bit, especially with the pandemic. Yeah, PH Spot, you asked about that, Gordon. It was something, I guess, that kind of evolved into what it is today without much thought or planning in the early days. Okay. Officially launched in January of 2017 as a brand or product or platform. Once I graduated from my master's in 2013, I was constantly receiving a lot of LinkedIn messages and emails from individuals who wanted to pursue a master's in public health. I think at the time there weren't many in Canada. And so people were really learning about this degree, figuring out what a career path in that kind of public health could look like. So, they would message me similar to how I was messaging random people before I went into my master's. So I felt like it was only fair. I kind of gave that back. And so I either sat on LinkedIn and talked to them, or if they were in the Toronto area, I'd meet them up at Starbucks and we'd chat quite a bit. And I remember one summer, so between 2013 and 2016, one summer, one weekend, I was there the entire day speaking to individuals back to back, just with my one cup of coffee. And I realized, one, it wasn't sustainable for me. I probably shouldn't be spending my whole weekend at Starbucks. And secondly...
Oh, right. In person.
In person. Yes, in person.
Oh.
Remember those days?
Oh, no. Okay. I'm thinking virtual stuff.
No, in
that's
person.
Before that.
Yeah, this was 2013, 14, 15, well into 16.
Wow.
So, and then I also remember telling one of those individuals that I was speaking to that, listen, you're getting this one person's journey, and it's super biased because I've only done my master's once at one school and have only had one job ever since graduating. So you should really go out and speak to people. And I think they had mentioned that they were a bit shy to reach out to any more people, people weren't getting back to them. And I had my network of public health professionals. And so I was toying with this idea of how do I get more people to share their stories? So that was kind of an independent thought. And then one of my friends was learning how to code and build websites, and he was just learning the theory. So I told him hey, why don't you build this platform where it pulls in a whole bunch of public health jobs, so it just filters it, and we have one page that has public health jobs all together. So he kind of, did that as his fun little project on the side. And I thought when he was going to show me what he had done, it would be one of those black and white pages of just list of jobs. But what he ended up doing was building this platform, and he had like done a little logo and all these pages, and it like brought something to life that I hadn't really conceptualized in my head too much. And so just seeing that, I think a light bulb went in my head because I had this like other idea. So we sort of like merged it together, and thought it'd be cool to add a blog to it as he was coding to pull these jobs together. And then, we launched it. The blog and the newsletter were like the most popular versus the job board. And also the job board was a bit tricky because it was pulling in like IT jobs at Public Health Ontario, even though it wasn't like a public health job. And that was a problem we were trying to solve, is like to filter out those jobs. And then, he wasn't in public health, so he kind of had other interests and he moved on. And Kajant, my husband, he then took it and rebuilt the platform for us to focus on the blog and kind of the newsletter and free resources. And so I think we launched the second version of that later that year in 2017. Funny story, he actually built it on our honeymoon when we were like taking a vacation in Australia for a month. So that's how passionate we were about like launching this.
Oh, wow. I don't know if that's a good or a bad
It was
thing,
good, right?
but,
Like
it
I'm
was
like,
good.
okay, I married the right man.
I love that.
Yeah.
There we
So
go.
he's been quite instrumental in building PH Spot. And then I think the number one thing we do is listen to our community. Like, what is it that they want? If they're asking for something, learn about that and build resources and tools and products. And the blog was, I'd get emails from people in the middle of the night saying, like, I was up studying and I read a story of like LaShawn and Gordon, and it really like inspired me to keep going, right? Because you kind of like see the art of the possible. And especially for people who are earlier on in their career, just to see individuals a couple steps ahead of them gave them a lot of like inspiration and hope. And that was the other thing. I didn't want to feature like the president of like some huge public health organization. It was really like our peers, people that are a couple steps ahead of us, so that we could learn exactly what they could do. So right now we have the blog, the podcast, a few great resources like that are all kind of free to download, and then just a couple paid products as well.
Cool. Tell us a bit more about the podcast.
Yeah, the podcast. I was doing just the blog for a while, and it was good. Like, I think we had a ton of content from the blog, and then I think there came a point where I felt like it was easier to get people like on a 1 hour call to hear about their story versus having them to write. Like, that whole process of touching base with someone to publishing was a lot, not only for us here like at PH Spot, but also for the individual. And so mostly it was like efficiency for how to create content. And then secondly, I was a very shy person. I did not like speaking. Like getting in front of the mic was going to be terrifying for me. So it was also a personal goal of mine to improve my like verbal communication. So I thought, podcast would be the best thing to do. So it took me a year of convincing myself, but eventually I said, let's just do it. And now I love it.
That's interesting, because before this recording, Gordon told me something. Gordon, do you want to share what you told me?
Yeah, I listen to, we often oh, my dog's sorry. But
that's how much you bore him.
Right. And then it's my same work desk, and he's like, oh, you're always talking to this computer screen. But so having started a similar product or journey, we often go back to listen to our first episode to see what our progress is like. And our first episode was absolutely horrible. Like, it was, my name is Gordon, and I listened to yours, and you came out of the gate, seemed like you were ready. But was there work behind the scenes before you even put out that first one?
Yeah. So what I had done was like go back and listen to podcast episodes of people whose I guess interview style that I really, really adored. And obviously Guy Raz from How I Built This. I don't know if you listened to that episode.
Right, How I Built This. Okay.
He's like one of my favorite hosts. So I went and listened to his, like re-listened to episodes I've listened to, but not for the content, but more the style of his interviewing, right? So he'd ask some really good questions, but they were often like, yeah, it wasn't, he didn't speak much. He would just be like, okay, tell me more. What do you mean by that? So I was really trying to pick up his style. I still haven't, but I think that was probably the reason that I kind of maybe sounded a little polished. But yeah, I have not had, I guess I am not brave enough to go back and listen to my first or second episode just yet.
But you know what? You are brave enough to start the podcast, and on top of that, do a lot of solo podcast episodes where you're just by yourself talking to people, and I think you do such a phenomenal job about it. And Gordon and I haven't mastered that art yet, so we'd love any tips you can offer about that, and especially to our audience, because we've been getting a lot of requests about how people can start their own podcast, and sometimes people don't have connections to bring people as guests, so the best way to just get started is to just talk, right? So what are some of your tips, and how did you kind of navigate that situation, just talking on the podcast by yourself?
Yeah, that does take a different level of, I guess, coaching yourself, because yeah, I think I probably broke through that because I was building our first course, the Infographics 101 course, and that was self-paced. And that forced me to have to record a whole bunch of videos by myself. So I think that sort of broke into it. And also, like, I think I mentioned it, how when we build anything or launch anything, we always go back to the community. So before launching the podcast, I had asked people on our community, like, what is it that you wanted to hear, right? So did you want to hear interview style? Did you want to hear solo episodes? And there was a good mix of interests. There were the interviews that people wanted to hear. There were kind of like career advice and tips people wanted to hear. So it was really led by what people wanted. And yeah, I think the first few were super awkward. But then I told myself, just write out the script and talk it through. And, just, I think at the beginning you turn on the mic and you stare at your screen for a good 5 minutes without saying anything because you feel like there's like something stuck in your throat. But then eventually now I could do it so quickly. It's just practice. Yeah.
Yeah, wonderful. You founded PH Spot. You have a lot of great people working for it, helping out with different initiatives. So I'm getting the sense that there is some sort of space for entrepreneurship in public health.
Yeah. It's, I was like holding myself back from sharing this because I did want to talk about it. When we did that survey about the podcast, one of the questions or topic ideas I had asked people, because I was super interested in it, was, would you like to hear from public health entrepreneurs on the podcast? And I was shocked to see that come up as the number one voted topic when we launched that survey. Yeah, so people are interested. I've done a horrible job of bringing on people that are entrepreneurs in the public health space because I think I haven't defined it well in my head. And, I brought on consultants who are running their own consulting firm. But I think like I'd like to explore that area a bit more and, talking to you both, and I'm sure we'll dive into this a bit more with this question. And I don't know how to define that just yet. And I think there's just like service-based, there's product-based, when we talk about product, it could be a physical product, it could be an app, it could be a platform. So I haven't personally just sat around to look through who's available. I think the other challenge I find is that maybe I'm being super picky because I want to find an entrepreneur who has a public health background and building a public health product, right? Like those three things are very difficult to find. Sometimes you'll find a product that does fit into the space of public health, but the individual doesn't come, like who the founder is, doesn't come from a public health background. And I guess I'm struggling with like, what kind of a conversation would I have there? What is it that individuals who are our listeners want to hear? Like, do they want to hear, how do I build a product? Or do they want to hear, how does someone with a public health background develop the skills in order to launch a product? So I think there's a bit of figuring out there, but I absolutely think there is a space for public health and entrepreneurship. Maybe we're just a bit, we're still like figuring it out in our field, and maybe we just need to take a bold step and try it out. And I think the best advice I have for anyone is, if you do have even the smallest idea, just start with something, whether that's telling someone about it, whether that's putting it out on your social media just to say like, hey, I have this idea. Anybody else interested? Do you want to talk about it? Let's collaborate. Like whatever it is, just take one small step towards it, because that first step is not going to be perfect, and that's okay. And just know that things are going to change. You're going to pivot 100 times before you land on something that you truly believe in. And there's a lot of learning. And I think if learning is something that you are interested in and can like get excited about, I think it's the best thing to do. Like I've learned so much.
While we're on this topic, it's important to, when we break it down, to think about what do we really mean in the first place. So I like that you mentioned too, we struggle with a lot of times, even our guests, we get people from healthcare backgrounds and they're marketing infection control products and filters. And we're like, it has public health implications, but it's not at its core a public health innovation. It requires medical biophysics and those kinds of engineering, and it's not really my space. So I do appreciate what you mean there. But at its core, just even business, it's about identifying a pain point or a problem and coming up with a solution. The solution has inherent value that you can sell at a cost. And they're just, for some reason, I've noticed too in people I've spoken to who could potentially offer up very good solutions, is that reservation of public health taking money. But then, I don't know if I'm explaining that right, but there's even us too, as we start off as a podcast, we start to do more consulting, and then it just feels like you're doing the wrong thing by not doing everything for free. Do you know what I mean? So I think that's probably a barrier for people coming in.
Yeah. I don't know that I have the right words to kind of explain that either. But I certainly had to do a lot of unlearning, mindset coaching. Ended up like investing into a coaching program to really get myself to like think differently. But I think one of the things that like stands out for me that is helping me change this is Kajant, who you've heard me talk about before, like
who was great on the one podcast.
Yeah, we recorded one together.
Yeah, no, I was like, does he podcast?
I told him that. I'm like, you have a great voice. You should jump on more. I think one thing he asked me very early on building PH Spot is because similar to you both, I was thinking like I could not charge anything for what I was doing. But like, honestly, like you both also know that you are spending most of your weekends and evenings on public health insight, right? Similarly, when we moved to Winnipeg, we didn't have any of our family there. So every weekend and every evening was on PH Spot because it was something I enjoyed doing. I built the stuff. I talked to people. And he asked me, like, would you do this if you could, like, full time rather than the job that you're doing? And I said, yeah, absolutely. But I can't because I also need to bring a paycheck home to pay for a house and food, right? So he's like, okay, then you should think about how to sustain this as a business. So there was like that question as to would I want to do this? And I think another individual who I follow is Pat Flynn. He has yes, and I think
smart passive income.
Yeah, and he also kind of talks about it is, wouldn't you want to bring more value to your community, the people that you're helping? And if you can do that kind of full time, invest all your time and energy into it, why wouldn't you? And if money is the only reason that's kind of stopping you, then I think it's up to us to kind of figure out creative ways to allow us to do this more and invest more time and resources into it. So, that's where when I started thinking about, okay, could I start making money here? The course that we built, Infographics 101, was one of our kind of like products that we launched, and it ended up being a successful launch. People, and again, before we build anything, we asked the community, do you want this? Overwhelming yes. People bought on the pre-sale. We delivered it. People loved it. We were able to take that money hire a few people to then come on board to support building that even further, like our platform. And, I am conscious that there are things that can't have such a high price tag, because we do want to ensure that that our products are accessible. LaShawn, that we ran the career program, and for one of our cohorts, we did launch a grant program because we did hear from individuals that it was something they needed, but they couldn't afford it. So we really wanted to make sure things like that were accessible. So we've since paused the career program because I'm challenged to think about creative ways to still bring value, still ensure that PH Spot is a sustainable business, but also making everything accessible. So I think, going back to that piece on learning, I think this has been kind of the fun part of it for me, is really learning about how to solve these problems, more on the business side of things, because I don't have formal training in business, but I've been resourceful enough to, just learn, quote unquote, on the job.
I love that. And I feel like we all get so much fulfillment out of our respective creations and this journey that we're taking, learning a bit about business, entrepreneurship, and all that other cool stuff. I feel like it should be a segment or a course within an MPH program to get that innovative thinking going. What do you think about that?
Yeah, I think I've heard even some people merging an MPH and an MBA together quite a bit. Yeah, I do wonder if there's space for more of a specialization in it, right? Take an MPH and kind of add a few business courses. And I think, if I remember correctly, it was Harvard that was launching kind of the other way around, more of a certification in public health for individuals who have other backgrounds. So I think there might need to be the flip side of that, where MPH grads or public health grads also are able to kind of tag on a couple of business courses or something to get some skills developed in that area.
Thank you for listening to the Public Health Insight Podcast, your go-to space for informative conversations, inspiring community action. If you enjoy our podcast, be sure to subscribe and leave us a rating on Apple Podcasts or Spotify. See you in the next one.